Hi, I'm Dr. Wendy Lee, and we're here today with Dr. Tal Raviv, who's going to talk to us about a talk he gave on complications of cosmetic iris implants. Dr. Raviv, why don't you tell us about your talk that you gave at ASCRS?
Well, I talked about cosmetic iris implants, which are being promoted and marketed outside the United States and outside of Europe. These are unstudied, unproven implants that are placed in the anterior chamber to change the color of the eye permanently. And I've seen a number of patients that have developed complications from this over the years and have explanted these. And really, they're a public safety hazard at this point that is not well rebutted in the press. Mm-hmm. What I presented was the literature so far has two large case series, and one was a United States study, which I was part of, with something called a new color iris. And more recently, there was a case series of the Brightocular implant. These are the two market available iris implants. Right now, really, Brightocular is the only one. There were severe complications. Greater than 50% of patients required a secondary or tertiary surgery, whether it was a corneal transplant, glaucoma shunt, cataract surgery, and in many cases, another iris type of repair. These implants are unfortunately being marketed on social media. They're being marketed through blogs. The lay press is covering it as a controversial procedure, even though it's as controversial as using machine-made silicone oil in a back alley. There's nothing controversial. These are unstudied and uncleared implants, and the marketing for them is also misleading in that they say they use FDA-approved materials, which may be technically true. It is silicone. Nevertheless, the lenses come into the eye, and what I tell surgeons, if a patient comes in with these implants, frequently what we find is the patients are very strongly attached to them and don't want them removed. They're very invested in it. They've traveled. They've paid a lot of money, usually somewhere in the Middle East or other parts of the world, and they refuse to remove them despite very, very high eye pressures and despite inflammation. Most of the patients are on eye drops for glaucoma or inflammation, sometimes for prolonged times. And when you see that, what I've learned is don't wait. Recommend immediate explantation. When these are removed early, we can have a good result. If they stay anywhere longer, they suddenly decompensate and patients don't do well. I want to just differentiate between the functional medical iris implants, which are in study in the United States, or such as the human optics, which are being formally studied. And ironically, human optics implants have been used to correct the iris malformations formed after the cosmetic implants. So that's a differentiation the public should know about. Nevertheless, these implants can be removed. There's a simple one-cut technique that I illustrated on how to remove these implants atraumatically in these phakic young eyes without causing any further damage. And I believe it's a public safety issue, and I hope one of the national societies puts out a strong notice of condemnation about cosmetic iris implants.
Well, thanks so much for being here today and giving us the information on this.
Thanks.